The FDA authorized a COVID-19 vaccine for emergency use, marking the fastest vaccine development in history. Most vaccines take about 10 years to create, but the coronavirus vaccine has made record time. Less than a year after the first cases were reported. It all started on December 31st, 2019, when officials in Wuhan, China, confirmed dozens of cases of pneumonia from an unknown cause. On January 7, 2020, that outbreak was confirmed to be a new form of coronavirus. Scientists got to work quickly. Just 3 days later, on January 10, the SARS-CoV-2 virus was sequenced. This was crucial in helping virologists understand how it was similar to other viruses and how it might move through the population and its relation to other viruses. Scientists at both Pfizer and Moderna chose to create a messenger RNA vaccine, otherwise known as mRNA, that triggers the immune system to create antibodies without having to use actual parts of the virus. This allowed for the vaccines to be created more quickly and easily.
The problem is that this is an evolving situation. Literally every day we learn a little bit more about it.
On March 16, just as the country was going into lockdown mode, with the virus spreading, Moderna began its phase 1 and 2 trials, officially administering the first shot of an experimental coronavirus vaccine. At this point, officials projected that it could be 12 to 18 months until a vaccine was widely available, even if trials went well. Pfizer and BioNTech followed Moderna's lead on May 5th, kicking off their own phase 1 and 2 trials. On May 15th, President Trump announced Operation Warp Speed, a partnership between the Departments of Health and Human Services and the CDC that would provide billions of dollars to vaccine developers with the goal of vastly scaling up operations in an attempt to roll out a vaccine by the end of the year.
We're getting ready so that when we get the good word that we have the vaccine, we have the formula, we have what we need, we're ready to go, as opposed to taking years to gear up.
It was a bet. Pay for the production of hundreds of millions of doses of the vaccine before it's approved. It's unusual in a typical vaccine development cycle for phases 1 and 2 to occur simultaneously. Phase 1 usually doesn't begin until the vaccine's second year of development, with phase 2 being administered in years 3 and 4. But by July 27th, Moderna and Pfizer were both cleared to begin their phase 3 trials and start their enrollment, with Moderna and Pfizer enrolling 30,000 and nearly 44,000 respectively. There have been some bumps in the road. The Oxford-AstraZeneca vaccine trial was put on hold after a patient developed an injury. It ended up being unrelated. Johnson & Johnson had a similar halt, but the president still promised a record timeline.
We're going to have a great vaccine very, very shortly. I think we should have it before the election, but frankly, the politics gets involved, and that's okay.
Trump and Pence continually implied a vaccine could be available in time for the election, a promise Dr. Fauci wasn't ready to make.
It's unlikely that we'll have a definitive answer at that time, more likely by the end of the year.
Dr. Fauci was right. We wouldn't have a vaccine in time for the election. But just a few days later, on November 9th, Pfizer announced their first interim trial results, showing a stunning 90% efficacy with no serious safety concerns.
The first one out of the gate, the Pfizer vaccine, has an extraordinarily high degree of efficacy, more than 90%, close to 95%. That is extraordinary. Now what we've got to do is we've got to convince people to take the vaccine.
On November 16th, Moderna announced that their trial had shown a 94.5% efficacy.
We have what look to be, two large clinical trials that show a phenomenal level of efficacy that no scientist would have ever predicted.
On November 20th, Pfizer applied for emergency use authorization from the FDA. On December 2nd, the United Kingdom became the first country to approve the Pfizer vaccine for emergency use. And on December 10th, an FDA advisory committee recommended the FDA grant emergency use authorization. But the pandemic isn't over yet. Distribution will be a challenge, and millions of people will have to wait months before getting their shots. Still, the speed at which we've mobilized to create these vaccines is historic, a scientific achievement for the ages.
In Tennessee, they reported a new coronavirus record on Sunday, more than 11,000 new cases. NBC News got exclusive access to the only children's hospital in the Appalachian region, where they're now seeing 3 to 5 kids with COVID complications a day. NBC News Now correspondent Dasha Burns is at Tennessee's Johnson City Medical Center. Dasha, at the beginning of this pandemic, we thought children weren't susceptible to extreme cases of COVID-19. But what have you learned after spending some time at that children's COVID ward?
Yeah, Allison, this is exactly what I've been hearing from the pediatric doctors and nurses that I've been speaking to, that at the outset, they were so hopeful that they would not see kids in their hospital beds. Now they're seeing multiple kids a day, either with COVID or with MIS-C, which is an immune reaction in kids who have had COVID that causes inflammation in the organs. And this was frankly surprising for me to hear those numbers, Allison, because this is not necessarily part of the national narrative. But the reality is, when you have this level of community spread, and in this region of Appalachia, their positivity rate is about 26%. Just about every day, they've been setting new records for cases and for hospitalizations. And that impact does trickle down to kids. The other factor here is this is an area where kids have underlying conditions like asthma. So you've got this respiratory condition and add COVID. And this is what you start to see here, these increasing numbers. I want you to hear from a parent I met inside the Children's Hospital, a man named Corey. He's the father to Isaiah, an 11-year-old boy who was hospitalized with MIS-C. Take a listen to his experience.
It's scary. I mean, it hits home and it's scary. I mean, as a parent, I think Hulk Hogan can run through walls, but I'd rather be in that bed than him at any point in time. And for him to be in that bed it's eye-opening, you know what I'm saying? It kind of skips 1 out of every 5 kids, and you never know, you never think it's going to be you until it's you, and then you're faced with that situation. You got to act accordingly. But I never thought that we would be here. If anything, I thought I would be here, and other than besides him.
Allison, the good news is kids do tend to be more resilient. They're much more likely to recover. They recover more quickly, but they're not invulnerable. And in this area, there are also a lot of children that live in non-traditional family structures. So kids that are being raised by grandparents, by great-grandparents even, who are incredibly vulnerable. So the message here is, even though we've been talking all day about a vaccine being around the corner, this is absolutely not the time to let up on any of those preventative measures. You got to keep these kids out of the hospital, Allison.
Dasha, you got exclusive access to that children's hospital. What else struck you while you were there?
Well, as part of our visit, we also went to the adult part of the hospital, to the ICU ward here, and spent some time with the nurses that I actually met back over the Thanksgiving holiday, Allison, when they were sounding the alarm saying things are going to get worse. Please don't gather. But of course, we are now smack dab in the middle of that post-Thanksgiving surge, and they are terrified about what's coming after the Christmas holiday. Allison, what I saw on that ICU floor, I don't even know how to describe to you. It was heartbreaking. The majority of patients were on ventilators. The nurses there told me that was not the case earlier in the pandemic, but now the patients they're seeing, they are sicker. And the experience of putting someone on a ventilator, that is not an easy process. It is a traumatic process, both for the nurse and for the patient. That is putting a tube down someone's throat, putting it into their lungs so they can breathe. They often have to paralyze the patient in order to do that. And I don't say this to be graphic, but this is the reality that they are dealing with. While we were there, we were only there for about an hour or so for safety reasons. But even in that short time, when we came in, there was one ICU bed that was open. By the time we left, a patient had been rushed into that bed. That unit was filled. And what these nurses are dealing with on a day-to-day, it's really tough to think about being in those shoes for a 12-hour shift every day, Allison.
Yeah, Dasha, you're not being graphic at all. It is really important for us to hear, to understand how serious this is and what kind of work those healthcare workers are doing, what people are going through, because this is really serious stuff. What else did they tell you about the toll this kind of work is taking on them? Because as you mentioned, I mean, you were there for an hour. These folks are doing this 12 hours a day after day after day.
Yeah, for that, I want to just play some sound from Allison Johnson. She's the nurse that heads up the ICU unit. Take a listen to how she describes the experience.
It's easier to say okay than it is to try to describe how you feel to people. And so I think we're all kind of in this mode of come in and do what we need to do, be supportive of our team, so we can continue to keep on. It's hard for me to describe to you what we feel every single day. And I wish I could. I wish you could see inside my heart and you could understand the struggle.
No, you're getting emotional.
I know, I'm sorry.
What do you want people to understand about what you do?
That we are working so hard and working to support our team, and we need our community to support us. We need people to take this seriously and follow the guidelines.
Allison, maybe the hardest part of this reporting is having those conversations with those frontline workers, seeing the pain that they go through. But it was also remarkable right after that interview, seeing them put on all that PPE, walk into those rooms and care for those patients even through all of that heartache. And by the way, I think I've said this to you before, but in this region, this is a small community. So oftentimes these nurses, they're caring for people they know. They are putting their neighbors on ventilators. It's just an indescribable experience, Allison.
Hey, Allison. So there is a mix of excitement and fear here. I'm at University Hospital in Newark, and this is the site where the very first person in the state is going to be vaccinated tomorrow morning. But it's also where they surveyed staff and found that only 50% of the staff here feels ready to take a COVID-19 vaccine. The other half of the staff that is not comfortable yet over-indexes as employees of color. So I spoke to 6 Black nurses in the Newark area about all of this. And what I learned is there is a long history of discrimination and segregation here. People have been hit really hard by this virus in Black communities, and so they've lost trust in many of the institutions that are supposed to serve them. On top of that, there is a long history in this country of mistreatment of Black patients in medical institutions. And then to top it off, there's also a political element here. Many Black residents of Newark, they are not big fans of President Trump, and they perceive him to have been involved in this vaccine, to have rushed it along, to have politicized it, and that makes them highly uncomfortable. Take a listen to this conversation I had with Black nurses here.
Show of hands if you're 100% sure you're going to end up taking this vaccine.
Eventually.
Approved. It was approved.
Yeah.
What do you think is at the root of people's fears?
I think it's very important that they see doctors and nurses who look like them. There is a sense of comfort in seeing someone who looks like you taking care of you.
I think for me, in my community, when people tell me that they don't want to take the vaccine and they reference the Tuskegee or Henrietta Lacks, I show them a picture of my 3-month-old grandson at the time when he got COVID. I show them the picture, what it looks like to see a 3-month-old intubated.
That trust piece is going to be key in the coming weeks and months. I spoke to the CEO of this hospital, Dr. Sharif El-Nahal, and he told me that trust is going to be what makes all the difference as they try to get up to a critical mass of people taking this vaccine. And they're working on it already. So they have healthcare workers, they have faith-based leaders going out into communities and trying to have one-on-one conversations right now. And the most important thing is listening to people and their fears and worries. That listening piece, they hope, will make people trust them and then get people to take the vaccine when it's their time.